for any kind of murmurs that you might have, which I don't really suspect since you don't have a history of them. I've never been told that you have one, so. Okay, very good. All right, you can lay back on your back here, get more comfortable. Any abdominal issues that you know of?
No.
Any problems like that?
No.
Let's see, you're over 50, so have you had your colonoscopy done so far?
Yes, I did.
Good. And everything was normal with that?
It's just fine.
I'm just listening in all of the quadrants here of your abdomen, just making sure that there's your bowel sounds are active, normal, everything like that. Alright, I'll go ahead and listen for bruise over here on your abdomen, but I don't suspect any since you don't have hypertension, you don't have any issues like that. But I'll go ahead and do so. Okay. I'm just going to do the percussion thing again like I did earlier. That's just to give me a good indication of bowel here. I'm going to do some light palpation just with my hand. Just to make sure, let me know if you're having any tenderness at all.
No.
No tenderness at all?
No.
I'm going to do what's called deep palpation with both my fingers, and it'll be a little deeper, it might be a little more comfortable. Any issues at all?
No.
Okay. Alright. I'm going to feel for your liver here. I'm going to put my hand underneath your right side.
Okay.
And I'll have you take, let's see, a deep breath in and out. Okay. Can we take a deep breath in and out for me? Can we take a deep breath in and hold it? Okay, then release. Okay, very good. Alright, I'm going to come over to your other side. Alright. So I'm just going to kind of percuss here. Check your spleen, make sure everything's normal with that. I'm going to make sure it's not too enlarged or anything abnormal. Any issues whenever I'm pushing down?
No, everything's fine.
Okay. There you go. Alright. And then I'm going to go a little further down your abdomen and I'm going to kind of palpate for your kidneys here. Alright, any pain with that?
No.
Alright, go ahead and roll over on your stomach for me.
Okay.
And I'm going to do what's called fist palpation, and in doing that I'm just going to make sure that there's no issues. You have any issues with that?
No. Everything seems fine.
Alright, good. Alright, go ahead and roll back over.
Okay.
And lay back on your back like you were.
Okay.
And I'm going to palpate here for your bladder, and you shouldn't be able to feel anything, and I know you said you went to the bathroom ahead of time, right? Okay. To make sure there's not overextended or anything like that. Alright, I'm going to feel for your abdominal aorta here. Alright. Just relax. Alright, and then I'm going to check here for what's called ascites, and you go ahead and just put your hand here, and then you put your other hand up here.
Okay.
Good. And I'm just going to use one side from the other and just make sure there's no fluid wave, no fluid accumulation that's going on in the belly here. I don't see any.
Cool.
Alright.
Oh, I'm sorry. I keep putting my shirt down. Okay.
Alright. And whenever I pop it over here in the left lower quadrant, are you having any right lower quadrant pain?
Nope.
Alright, good. Alright. And then we'll go ahead and have you put your right knee up. Like that. And you can just kind of bend it like that. Are you having any pain with that?
No.
In your right lower? Okay.
Seems fine.
Okay. And for your right thigh here, I'm just going to kind of internally rotate it like that. Any pain on your right?
No.
Okay. Those are typically signs that we use to detect if there's any issues with the appendix, so that's good. Any pain whenever I do palpate right over the appendix on the right lower quadrant here?
No.
Okay. Okay, good. All right. And whenever I pinch up like on the skin here a little bit, are you having any issues with that?
No.
Okay. Good. Or do you have any pain right now, or issues or anything with your urinary system, your rectum, anything like that?
No.
Okay. That part of the exam we're not going to do today because we'll go ahead and defer that and put that off for your yearly exam and everything like that. As far as your lymph system, do you have any issues with that? Any problems with vascular, any blood clotting, any issues that you know of?
No. I'm pretty healthy.
Good. I'll look at your nail beds here. And your skin and check any of those. Alright, I'm just going to palpate your pulses here. In here. Okay. And then what's called the epitrochlear notch, which is right here. Let's kind of feel here. Very good. On the other side. Okay, good. Go ahead and alright. I'm just gonna kind of feel as best I can through your pants so I don't expose you all over the place. Just feeling for your femoral veins, your arteries, and your nodes there. Alright, I'm just gonna feel behind your knees here for your pulses. And then on your feet. And on the inside here. Alright, you don't have any swelling, any edema in your lower extremities, which is really good. Just going to kind of feel your temperature here. Alright, good. Make sure it's not overly warm or any issues as far as that goes. I kind of felt that earlier here. Good. Alright, so go ahead and have you do this with your hands. Actually, I'll just do one hand here. Just make a fist for me. I'm going to include these. Alright, and then just let your hand go. And then I'm going to, very good. Just making sure the blood return comes back and all that. Go ahead and do it with the other hand. And do the same thing that you did. Go ahead and, very good. And then open your hand slowly. And we'll let that go. See how it comes back, the color comes back like that? Go ahead and put your feet up about 60 degrees here. I'm just going to watch and look at the bottoms of your feet here, your soles. Alright. Good. And then we'll have you dangle on the side of the bed. Basically what I'm checking for here is just to make sure that if the color returns to your feet, and it did very quickly. A lot of times people have issues with that and it looks very good.
Okay.
Go ahead and have you stand up.
Okay.
I'm just checking for varicose veins here.
Okay.
Put my hands here. Okay. You don't have any issues with that as far as you know?
No.
Okay. Okay, good. Go ahead and lay back down like you were. Alright. And then we'll just have one of your legs and we'll lift that up about 90 degrees. Alright. And this is what's called the Trendelenburg test, and it's not the best setting that we have going today to do it. But we'll do it as best we can. I'll go ahead and have your leg 90 degrees. I'm going to occlude your great saphenous vein. And then what's going to happen is I'm going to have you stand up, and then about after 35 seconds, we're going to make sure that the return of blood does come back. And it's normal if no additional filling happens after about 20 seconds. So, alright, I'll go ahead and have you kind of swing your legs over and stand up like you did before. Okay. Very good. All right. Go ahead and sit down. You next.
Okay. Whew, you're pretty thorough.
Yeah. Any problems with your musculoskeletal? Any problems getting around, moving, anything like that?
I think I'm doing okay.
All right. I'm going to check and make sure there's no redness, inflammation, warmth, any issues with your joints or anything like that. Okay. All right. I'm going to put my hand here and go ahead and open your mouth there. Any issues with that whenever I palpate that? Okay. I'm going to just kind of put your arm out like your shoulder. Just kind of